Hello and welcome to our introductory video on our company Health Action Training, or HAT for short. We're really excited to be included in the Performance for Care website and discussion. I'm Carl Tazalkleister. I'm a PhD candidate at Ulster University.
And I'm Matt Jennings, a lecturer in drama at Ulster University and internationally experienced applied drama practitioner and researcher.
I'm Pat Deeney, Senior Lecturer in Nursing and CEO of Health Action Training.
Pat, do you want to start us off with a little explanation of where the idea for HAT came from in the first place?
Yeah, the idea came from our need was to improve the quality of role play. That was the first point, and particularly deal with students' anxieties around role play, and they're really were not progressing sort of their quality of role play in any way. And we also had to be better at assessing role play. So the Health Action Training approach really was helpful in the early days.
And Matt, do you want to talk about what techniques we started using and what we use?
So yeah, to start out with, I was asked by Pat to come and help out with the nursing students who do the role plays for assessment that every nurse practicing in the UK has to pass in order to be registered. People might have heard of OSCEs, or Objective Structured Clinical Examinations. So not unlike a lot of nursing students in the rest of the UK and the world, people found these fairly intimidating experiences. They struggled to take them seriously. They struggled to make them convincing. They felt awkward and worried and anxious about them. So we start out with doing a bit of centering, breathing, relaxation exercises drawn from voice exercises that be familiar to drama students and also martial arts and so on. And then we use various other exercises to develop skills in paying attention to oneself and to other people. We use a bit of image theatre and mirroring and exercises that would be familiar to people who've used Boal's Theatre of the Oppressed approach. And we also introduce them to the idea of intention. So it's centering, attention, and intention. And in intention, we use techniques and concepts derived from Stanislavski's method of physical action, such as actions, objectives, and given circumstances. And we think about and rehearse the scenarios they have to perform for their role play assessments, using those terms and teaching them ways of thinking about those techniques in a games-based approach initially, low-focus games-based approach where everybody might be playing a given circumstances type activity, such as giving bad news to relatives of a patient, through to actually applying those specific concepts and techniques to the specific scenarios that they are assessed on, which are also all drawn from clinical experience. So they start to be able to apply those ideas and techniques not only to their role play scenarios, but also to their clinical practice when they're on placement.
Yeah, and very quickly it became apparent that this was applicable to a broad range of different simulation practices. And for instance, this is something from the Community Resilience or Disaster Response Simulation Day. Pat, do you want to speak a little bit about that?
Yeah, we run the largest community resilience or disaster simulation exercise in Ireland. We run one every year, and in this the role play is absolutely key, and we used Health Action Training methods to again improve the role play, but help the casualty actors who were nursing students to perform the role better and think of their objectives and pay attention to detail that was really important.
It's important to note that this training approach is rooted in a person-centered nursing framework, and sympathetic presence is a process within that framework that we approach.
And that's kind of where we got pretty excited about it, because a lot of acting training techniques are about being present and emotionally responsive, while at the same time not necessarily assuming empathy of, feeling the same way as everybody else involved.
The other thing as well, that again, that was helpful to us as a group of teachers, because we had to be sure that our graduates could be sympathetically present in the patient care situation. And this
That extended even not just to people, did it, Pat? Being sympathetically present with the mannequins, the medical mannequins that they often use for invasive procedures. Do you want to talk about that a little bit, that little development?
We were able to move the whole idea then towards use of puppetry or applied puppetry. We were working with mannequins, teaching nursing students how to carry out clinical skills, and we were finding that maybe they were treating the mannequin as an object, and this made us feel very guilty in a way, because we thought we might be reinforcing something that would also be the opposite of what we intended. And the puppetry really helped us a lot, because it made the student focus and believe more in the mannequin as an individual. The mannequin played a key role in the role play, and the students began to pay attention to small details, particularly subtle movement and communication at the level of breath. So it was really helpful.
Absolutely.
So the core principles as identified and developed by Karen Torley, who's the puppeteer who was working with us on that, breath, belief, focus, and touch, are not only easy to remember, but also very easily teachable as well. Like with a 15-minute session with a group of 40 students, we can impart enough understanding of basic puppetry skills that they can animate the mannequin effectively enough that the other role players within the scenario will be looking for non-verbal cues from that mannequin to give consent and so on.
Yeah.
Which far more effectively than, say, automated robot versions of mannequins.
Yeah. And Matt, do you want to maybe mention the train the trainer approach that we're hoping to develop towards as a long-term strategy?
Yeah, well, so the whole thing has been, the more we've done it, the more we've found wider applications and greater enthusiasm from large numbers of people all over the world to provide this kind of training. I mean, as our new chapter in Performing Care, New Perspectives on Socially Engaged Performance describes.
Who was that edited by? Who were the editors of that?
Edited by James Thompson and Amanda Stewart Fisher. Our chapter in that provides substantial evidence that's compiled from international research that the single biggest problem within healthcare training and delivery is communication, and the most significant absence within training, both undergraduate and continuing professional development, as effective communication skills training. So there's enormous demand for it.
Pat, do you want to close us out with talking a little bit about what HAT aims to do in the near and long-term future?
Well, we've just received a significant grant from the Burdett Trust in partnership with the Western Health and Social Care Trust. And we're looking forward to rolling this whole idea out now with registered nurses in a range of clinical settings across a range of issues, if you want to call it, both in dealing with risk assessment right through to OSCE assessment. And we were quite surprised in the initial discussions that there's so much enthusiasm right across the board, from children's nursing right through to palliative care to critical care. And in the present context, it's really helpful because we're actually considering doing quite a lot of mask work to enhance communication skills as well when practitioners have to use personal protective equipment. So an exciting project, I think.
Thank you very much, gents. Thank you so much for having us, the whole team of Performance for Care. And we really look forward to continuing to engage in discussions and dialogue and possible future partnerships. We're Health Action Training. Goodbye.
Look after yourselves and each other.
Thank you.
Thank you.